A radiographic exam performed on a patient with a cast should begin just as any other exam, starting with the setup of the room before the entrance of the patient. Once your patient is in the room and made to feel safe and comfortable, a medical history should be taken. Always verify your patient's last name and date of birth, and be sure that your questions are relative to their condition. For casted patients, include their date of injury and any surgeries that may have taken place. Also, never forget to ask a female patient about a chance of pregnancy. When moving a cast, be sure to use open, flattened hands beneath the cast. Offer support at the joints. For extremities, this includes both joints. Always be sure to move a casted extremity as a single unit in one motion. Here are some good examples of how not to handle a cast. You should avoid movements that are too rough or too fast, and always avoid pinching the cast between your fingers. You should also avoid improper joint support. Always be sure to use 2 flat hands and offer support at both ends of the cast. The improper handling of a cast could lead to many issues, including a deformed cast, which could extend injury to the patient or cause decubitus ulcers to form. It could also cause nerve compression to the patient or circulatory impairment. A casted patient in the diagnostic imaging department for any length of time needs to be reassessed every 15 minutes for nerve compression or circulatory impairment. Some signs of impaired circulation and nerve compression include pain, coldness, numbness, burning or tingling sensations in the fingers or toes, swelling, a change in skin color to pale or blue, an inability to move the fingers or toes, and a decrease in or absence of pulse. If the final 3 symptoms are noted during a patient's assessment, you must calmly inform a physician, and an attempt to relieve the pressure will be made. If you come into an issue with a casted patient, always remember to never try to take matters into your own hands. Always remain calm and inform a physician before any attempts to relieve pressure are made. Always remember to be gentle during an exam on a casted patient. Be sure to use the proper techniques to position the cast with open hands, offering support at joints. When imaging extremities that are casted, be sure the entire extremity is on the same plane. Always place your marker and perform your exam as you normally would to the best of your abilities in regards to your patient's condition. Always remember your ALARA principles as low as reasonably achievable. Apply proper collimation and centering to all of your exams. Something to keep in mind if you are performing an exam that involves a cast is that there are 2 different kinds of casts that are commonly used, and the kV range differs between them. This may not affect you if you are using a digital system.